Good morning. We are here with my paramedic partner, very gracious training officer, Dave, and we are pretending he doesn't know anything about the heart today, so I'm going to teach him all about the heart.
Show me, Katie.
So, this is my very nice drawing of the heart. What I'm going to do first is show you the gross anatomy. So, the heart has two upper areas called atrium and two lower areas called ventricles. The blood that comes into the heart goes through these things. They're called valves. This would be the tricuspid valve, and this one would be the bicuspid valve. Blood enters the heart through the superior and inferior vena cava. It comes into the right atrium, comes down into the right ventricle, and then is pushed up by the left ventricle into the pulmonary arteries. Pulmonary arteries go to the lungs. Inside the lungs, the blood goes through tiny capillaries and comes back as oxygenated blood in through the pulmonary veins. The pulmonary veins empty into the left atrium. From the left atrium, blood gets pushed into the left ventricle. From the left ventricle, blood gets pushed through what is called a semilunar valve called the aortic valve. Blood is pushed up through there and out to the rest of the body. The mechanical function of the heart is to push blood from these atria into the ventricles and from the ventricles to their respective areas, the pulmonary and the systemic circulatory system. To do that, the atria contract downward and push blood into these ventricles. These ventricles will contract inwards and upwards after these valves close to take their blood to their respective circulatory systems. Along with the mechanical function of the heart, there is a very important electrical function. The heart has three nodes, three places where electrical impulses are generated. The first one is called the SA node or the sinoatrial node. The sinoatrial node innervates through the atrium, both atrium, and then goes down through what is called the AV junction. From the AV junction, you have the bundle of His and separates into the right and the left bundle branches. The SA node has a beat of 60 to 100 beats per minute. The AV node will regulate the heart at 60 to 40 beats a minute, and the bundle of His will keep the heart rate above 40. After these bundle branches, you have nerves going through the heart called Purkinje fibers. The great thing about the heart is the cells themselves in the heart are also automatic, which means they can fire by themselves. The central nervous system also plays a role in regulating the heart rate. So the sympathetic system will tell the hypothalamus to release epinephrine, which will increase heart rate and increased contractile force, which in turn increases blood pressure and makes sure that the body systems have enough blood to perfuse their tissues. Oppositely, the parasympathetic uses the vagus nerve to bring heart rate down when it's not needed to perfuse so greatly in the rest of the body. That is the heart. I hope you learned something.
I did, thank you.